Let's go over antihypertensive basics. You can remember all the antihypertensives with the memory trick A, B, C. A for ACE inhibitors and ARBs, B for beta blockers, and C for calcium channel blockers. It's so important you know the suffixes for each of these medication classes. The suffix for ACE inhibitors is pril. A classic example is lisinopril. The suffix for ARBs is sartan. A classic example is valsartan. The suffix for beta blockers is olol. A classic example of this is metoprolol. And the classic suffix for calcium channel blockers is dapine. A classic example is nifedipine. A great memory trick for ACE inhibitors is to think ACE. A is for angioedema, which is a potential side effect of this medication. C is for a cough. ACE inhibitors can cause a dry, annoying cough. And E for elevated potassium, which is another side effect of this medication. Now, a fun memory trick for ARBs is ARBs, which stands for ACE-like effect because it's very similar to ACE inhibitors, but it has reduced bad symptoms. ARBs are known to produce fewer side effects than ACE inhibitors. All right, next we have beta blockers. For beta blockers, you can think of all the B's. The first one is bradycardia. Beta blockers can cause bradycardia. Breathing problems like bronchospasms or bronchoconstrictions, which is why they're bad for asthma patients. B for blood sugar masking. Beta blockers can actually mask signs and symptoms of hypoglycemia. B for blood pressure lowered, obviously because this is an antihypertensive. And lastly, B for blocks beta 1 and beta 2 receptors. And lastly, we have calcium channel blockers. A good memory trick to remember for calcium channel blockers is to think calcium and citrus clash. You need to educate your patient that they cannot drink grapefruit juice on calcium channel blockers. This can cause severe hypotension. So remember, calcium and citrus clash.